Mumps is also known as parotitis. This infectious viral disease is known to cause inflammations and swellings of the parotid, sublingual, and submaxillary glands. In males, it causes orchitis, which is known to be the swelling of the testicles. Mumps is most commonly transmitted by the mouth, by small drops of saliva passed from the infected person to someone else. This virus is spread by coughing, sneezing, talking, or by sharing drinks. Mumps most likely affects children between the ages of 2 through 12, and it also affects adults who have HIVs or people who go through chemotherapy. The causative agent for mumps is known to be paramyxovirus, which is a large family of single-stranded RNA viruses. This agent specifically attacks the cell membrane and uses the fusion of virion to enter the cell. After entering the cell, it uses the host cell for its own purpose and destroys the inner surfaces. The MMR vaccine protects our bodies from measles, mumps, and rubella. Children are given the first vaccine before their first birthday and before they start school. Adults can be given the MMR vaccine at any advised time. Many people who develop mumps say they feel pain in the abdomen, muscle, neck, pelvis, or testicle. The most common is dry mouth, headache, hearing loss, neck swelling, swollen lymph nodes, or swollen salivary glands. They find it difficult to swallow, and the throat is usually sore. They feel chills down their whole body, fatigue, fever, loss of appetite, or malaise. This lady seems to be having pain around her lymph nodes and salivary glands, and that's because by day 3, the salivary glands are tender and swollen to touch. The next few pictures provided show what an individual looks like after they've developed the mumps virus. Long-term effects of mumps include encephalitis, meningitis, and deafness. Short-term effects include inflammation of the glands and inflammation of the pancreas. In the early 1950s, America used to be very commonly affected by mumps, averaging 200,000 cases yearly. After the vaccine was introduced in 1967, the 200,000 cases were brought down to only 300 cases per year. The highest risk for developing mumps is in locations like college dorms, daycare centers for kids, military bases, and some specific schools in certain states. Recently, the Indiana State Department of Health has confirmed that there have been many cases of mumps on campuses like IUPUI, Butler University, and Indiana University, Bloomington. There have been 9 cases on Butler, 4 cases on IU, and 1 case on IUPUI. Out of fear, many colleges are giving students free MMR shots to prevent the virus from spreading. Unfortunately, there is no cure for mumps. Anyone with mumps has to wait for the virus to go away by itself, but there are ways to relieve other symptoms. In order to relieve the first symptom, it's essential to drink water, about 8 glasses or more a day. It's important to avoid fruit juices because they stimulate the production of saliva, which may be painful. Place something cold on the swollen salivary glands to reduce the pain and swelling. Take time off from work or school to get enough rest. Also, this may reduce the risk of contaminating others. Gargle with salt water. Take a Tylenol, Aleve, or ibuprofen. Take some herbs like cleavers, caladuna, which target the lymphatic system and increase the activation of the body's internal filtration system. In conclusion, it's important for an individual to know that in order to prevent many dangerous and harmful diseases, it's important for you to wash your hands.